a collaboration between academia and Roche, testing the potential benefit of 1 year of adjuvant bevacizumab in women with triple-negative breast cancer. The design is shown here. Patients had to have centrally confirmed triple-negative breast cancer. They received chemotherapy of their own investigator or site's choice, but the chemotherapy had to either contain a taxane and or an anthracycline, or they received the same chemotherapy plus 1 year of bevacizumab in the dose equivalent to 5 milligrams per kilogram per week. And the trial was stratified by the usual sorts of criteria. This slide summarizes the patients who went in. You can see here that around 30% of patients had stage 1 breast cancer, 60% had tumors between 2 and 5 centimeters. The vast majority had completely absent hormone receptors. There were a small number with low levels, and just under 2/3 of patients had node-negative disease, and 70% were high grade. The trial was recruited between December 2007 and March 2010. This summarizes the chemotherapy planned, so that the commonest group was anthracycline plus taxane. It's just under 60%. 1/3 of patients got anthracycline only, and less than 10% got a taxane-only regimen. This slide shows the outcome, and we can see, unfortunately, for women with triple-negative breast cancer, adding bevacizumab for 1 year did not statistically significantly improve the disease-free survival. The endpoint we chose, what's called invasive disease-free survival, includes other invasive cancers, just in a sense as a check to make sure that we're not inducing cancers in a different area. The hazard ratio, as you can see, was 0.87, but this is not statistically significant. In terms of overall survival, this is an underpowered analysis, in the sense we've only had 59% of the required events for the original statistical plan, but again, there's no significant improvement in overall survival for these women. But please note in both curves that the yellow arm, that's the women who were treated with bevacizumab, lies above, so there's certainly no evidence that they came to any harm in terms of the pattern of recurrence of breast cancer. The toxicity of bevacizumab in combination with chemotherapy is pretty well known. So we've summarized here the most common adverse events of grade 3 or higher. You can see in the top 3 lines that there was no increase in bone marrow suppression. Highlighted in red are the side effects that we have learnt to see with bevacizumab. Firstly, induction of hypertension, which is usually manageable with 1 or 2 antihypertensive drugs. The definition of grade 3 hypertension is simply that they needed 2 blood pressure drugs. And down at the bottom, you'll also see an increase in proteinuria, which is cumulative over time, in the sense that it became more common in the maintenance phase after patients have been exposed to bevacizumab for longer. There's no other major problem with toxicity in terms of the side effects seen in this trial. Now, there's also a lot of concern, as we've seen with Herceptin, as to what may be the cardiac effects of this drug. So I'm going to walk you through the slide slightly more slowly, because it's important to think about this. We, as in all the Herceptin trials, prospectively measured the ejection fraction using an imaging test. Patients had to have a normal ejection fraction of 55% or higher to go in, and they had sequential analyses. Now, if any of us in the room had 2 tests and 2 consecutive days, we would not get the same number. The values change day to day. And so you need to define what you think may be, not is, but what may be clinically significant. And the criteria we chose was a drop from baseline of 10% or more, plus a drop to below 50%. So that's down into the range that is clearly not normal. So this summarizes what was seen, and you can see that there were more patients who had a drop of more than 10% and below normal on the bevacizumab arm. And you can see for the anthracycline group, it's slightly higher than in the anthracycline plus taxane group. But there were patients who didn't get bevacizumab who had similar levels of drops, but it was higher with bevacizumab. In the middle of the slide, you'll see the rate of what is clinically significant heart failure, scored by the NYHA group, and we had 0.5 and 0.6% respectively of grade 3 and grade 4. So the rate of true clinically very significant heart failure was extremely low, but it was slightly higher on the bevacizumab arm. The second question is, if you have an event like this, how quickly do you recover? And Martin referred to the same issue with Herceptin. So this summarizes the resolution rate of these drops in ejection fraction. So for all grades, in both arms, 80% of patients had a recovery. If you look at the more serious events, which were rarer, in fact, more of the bevacizumab patients recovered. So only half of the patients who had a significant drop without bevacizumab actually recovered during the study time. So again, yes, there are changes in ejection fraction. There is a low rate of more severe heart failure, but this is nothing outside what would have been expected for this drug. So in conclusion, this is, as far as we know, the world's first big phase 3 adjuvant trial in a triple-negative breast cancer population. And the good news for women is that the outcome at 84% was actually much better than we had originally planned. So women, when they go onto the web and look up what is a very negative image of triple-negative breast cancer, we can at least say in a big worldwide phase 3 trial, actually the outcomes are maybe not as bad as the older literature suggests. But in terms of an improvement in outcome, giving 1 year of bevacizumab isn't the answer. The safety profile was very much as we would expect from other data with this drug. And we will continue to follow these patients up, and we'll have a powered survival analysis in around about a year's time. And importantly, there is a correlative science program going on looking at markers of angiogenesis to see whether there may be a subgroup who would benefit. And there's a poster later on today demonstrating some data from this trial addressing that question. Thank you.